everybody, Dr. 𝐚𝐫𝐞𝐳. Today I'm going to do a video on how I treat patients with vertigo. So many of my patients who have come to me get a little bit of dizziness, they get a little wooziness, they turn their head quick, sitting up quick, getting out of bed in the morning. They feel like either they're spinning or the room is spinning, and that could be a sign of vertigo. One of the causes, there's two main causes of vertigo that I've come across. One is the crystals in the inner ear, which is more of an ENT situation, but I would have to say a good majority of patients that come to me with vertigo have what's called cervicogenic, meaning coming from the neck or the cervical spine. When there are misalignments or vertebrae that don't move, or maybe vertebrae that are pinching on a nerve, especially in the upper part of the neck, that can give you a headache, that can give you dizziness, that can give you vertigo, that can give you wooziness, brain fog, all of those things. So I'm going to show you how I adjust a patient's upper neck who has vertigo. So usually you have 7 bones in the neck spine. Usually the first 2, C1, C2, potentially C3, are the culprits when it comes to vertigo. So I'm just sort of feeling around Sue's neck right now, and then I'm going to adjust the top part of her neck. So a little pressure. Good. And one more coming back. Relax this. Good. And then I'm just going to do a little long axis traction, which is a type of stretch that separates the joints, because many of my vertigo patients are a little bit older and sometimes have arthritis or loss of disc space in the top parts of the bones of their neck. So separating those joints out with what we call long axis traction also helps to alleviate the pinching and the pressure on the nerves, on the discs, and on the joints. Okay, so if you're struggling with vertigo or know someone who is, and you're not sure if it's coming from the neck or the actual inner ears, have them get their neck checked. We can take x-rays, we can see specifically where those joints are moving and where they're not, and help get them treatment with adjustments to help alleviate your symptoms. Okay, Dr. Jody signing off.